Hey guys, it's me, Mr. 250, and welcome back to Trauma Center New Blood. We're back here again just after the old hospital closed, and we are going to get an icy welcome to what I'm assuming is, in Los Angeles, the new medical area. Concordia's secret. Maybe it's not all it seems.
How embarrassing. I can't believe I forgot it on my first day back. Oh, good morning, Marcus.
Morning. What are you doing out here? Aren't you going in?
I got stopped because I forgot my ID.
Wow.
I told them to call Billy at the reception desk, but he doesn't work here anymore.
Well, it's been 3 years, so I can't say I'm surprised. All right, I'll go straighten things out.
Thanks.
Good job, world-class doctor. You forgot your ID.
Really, Dr. Vaughn.
Hey, Dr. Russo. It's been a long time.
Hello, Dr. Blaylock. How was Montgomery Memorial?
Well, it was certainly challenging.
Very cold, I imagine.
I have
Lots
to admit,
of bears,
I was quite envious
probably a few
when I heard that
Canadians.
you were going. I mean, who wouldn't want a chance to get in touch with nature?
That guy got in touch with a bear.
I heard that you became chief surgeon. Congratulations.
Ah, thank you. Of course, that was 6 months ago.
Sorry, I've been a little out of the loop.
Think nothing of it. I understand completely. After all, you were quite far from civilization. Oh,
Man,
by
we have the
way,
bears everywhere.
Professor Wilkins is expecting you to. He's waiting in his office on the 5th floor.
All right, we'll go see him.
I wonder why they asked you to return, seeing as how you've made little progress on your research. This hospital must be busier than I thought. I hope you two live up to your reputations.
Well, we do have the ability to
Well
stop
then,
time and
If you'll excuse
stabilize
me,
vitals, so I'm sure we're important
I see
enough
he's
for
still
something.
as charming as ever.
At least you know what to expect from him.
These operating
Dr.
rooms
Wilkins?
look a little fancier.
Ah, welcome back.
He has a monocle. That means he's either evil or he's incredibly intelligent, or a mixture of both.
I've been waiting for you for quite some time.
Yeah, it took me a while to decide. Have you been bedridden?
This disease can be debilitating, but the symptoms haven't progressed that far just yet. I'm in better spirits than I look. In fact, I even make the rounds occasionally. Of course, that's only for the time being.
What's this disease you're referring to?
Relax, my dear. The symptoms have temporarily subsided. Once I've made the necessary arrangements, I'll explain my situation in greater detail. After all, this is a confidential matter, even within these walls.
It's a secret?
Yes, you could say that I am both a patient as well as a research subject. For now, I'd like you to resume your normal duties. I'm sure Rousseau will find something for you to do.
I'm sure we can find more Canadians that have been attacked by bears.
Yeah, I'm sure he will. Well, we'll get to work then. Call if you need anything.
Marcus, you went against my orders and ran off to Alaska. But in the end, you were forced to return here. I won't reproach you, as long as you accept your fate.
Is that what you want me to do?
Indeed.
Uh-oh. Sounds sinister.
Hi, Dr. Blaylock.
Hi, you still haven't changed out of your stupid clothes.
Oh, hello, Elena. Are you starting today?
Yes, I am. I actually just returned from a brief vacation.
I need to hurry up and get back into the swing of things here. But it's hard because there are so many new faces.
Valerie, are you in? We've got an operation to perform.
Are you serious?
Russo took the liberty of volunteering us. Nice guy, huh? I have a feeling this is just a taste of what's to come.
All right, I'll go prep. Elena, can you assist?
No.
Definitely.
Oh,
I'll start
of
setting
course.
up immediately.
Why do... I just want half an hour. I just want half an hour to record. And then someone's gotta call me. Be right back. Okay, back again. Sorry about that. Just... It was an important call. That's all it was. Anyway, let's begin the operation.
Allow me to begin the briefing for today's operation. Well,
What?
Oh, am I making you nervous?
Look at
Just
that guy's
pretend
hair.
I'm
He's just
happy.
like, oh, look at me. Look at my fancy hair. I hope I'm not making you nervous or anything
Please
with my
continue.
fancy hair.
the patient is suffering from a putrefactive lung abscess due to Staphylococcus aureus.
That's incredibly deadly. Is that staph? I think that is.
Both the X-rays
Yeah,
as
that's
well
staph.
as the CAT scan support this diagnosis. You have two objectives for this operation. Look for a shadow using the ultrasound, make an incision, and drain the pus.
Ugh.
And of course, excise the tumor that's causing the problem.
Sure thing.
Is there anything you'd like to add, Dr. Russo?
Oh no. Oh wow, I
Merely
managed to
observing.
I managed to nail his first two words.
We'll
Oh
try
no.
not to disappoint you.
I'm just observing. Okay, let's go with Valerie.
Well then, let's start the procedure.
Got nothing better to do, right? Start the procedure.
Let's begin the operation.
We'll
We'll show Dr. Rousseau why we're here.
show him why we're here. Let's do this, team. Of course, you got to think about how that there's two doctors operating, but really one of them's just sitting there looking.
It's festering.
Ugh.
We need to drain the pus.
Otherwise,
Alright.
it could lead to inflammation.
So,
It
cut out
looks
the
like
tumor.
there's a tumor. I recommend that it may begin to
It's like-
fester.
it's like-
we need to drain
it's
the
like there's
pus.
some other
Doctor,
procedure that
it's
I'd like to
becoming
use.
inflamed. I think you should inject some anti-inflammatory.
I'll get to it. I'll get to it. Ah, dang it. This is so hard to hit sometimes. Stop that. It's not nice of you.
So far, so good.
And I bet there's
But
more we have
according
to look down. Yep.
diagnostics, the affected area may be larger than it appears. We need to use the magnification tool to take a closer look.
Let's start up here, and then we'll go down below.
Well done, Doctor.
Ugh. Look at all that nasty pus. Oh man, they're actually losing quite a bit of vitals from all this. I think you get extra points for not
Looks
using
like
the healing
diagnostics
touch.
were correct. We've got more work to do.
Let's inject anti-inflammatory. I don't know what holds. I don't know if the pus just keeps going, or if I reduce the amount of inflamed areas, if it'll go down, or if it'll be generated less. Sorry about that laser guy. Totally didn't mean to zap your lung for no reason. Okay. Let's get a tumor down here, and then we'll move up. Oh. Stupid pus. Get out of here. You're making this guy's vitals go down really fast. No, they'll be fine. They'll be fine. Don't worry. Just gotta inject them with alien juice. We're gonna go up and get all that crap up there. I'm sure that's not helping them. Man, there's tons of it. Doesn't look good for you, guy. Doesn't look good for you. You might die. We're doing everything we can right now, but you're just not looking very good today. You have very nice lungs, except for all the inflammations all over them. Dang it. I need to find where those tumors are so they stop popping up.
The vitals.
Yep, I'll get it in a
Don't
second.
forget to treat the affected
Okay.
area.
Never mind, we gotta boost their vitals. They're dropping way too fast. Okay, let's get a membrane. Cover that up. I think the worst thing really is injecting this anti-inflammatory. Like, it's so hard to land properly at times. Okay, let's get rid of all these. Maybe if we had bigger syringes, this wouldn't be as bad. Of course, I'm sure I'm doing this the least efficient way I could possibly do it. Wouldn't surprise me.
That seems to be the last one. His vitals
Ta-da!
have stabilized. The affected areas have all been treated.
It only took me almost 4 minutes. That was
Now let's
not great.
close
I'm
him
sure I
up.
could have done that a little faster if I was a proper surgeon. I mean, I am a proper surgeon. I'm on my off day today.
Looks like the procedure was a success. Good work, Doctor.
That's right. Dr. 250 here to save the day. I may screw up a few times, but you're gonna make it, no matter how much green juice we have to inject you with. Okay, can someone explain that to me? How in the... I didn't do that very well. I know I didn't do that mission very well. And I got a B on it. And I done some of those other ones so well, and I got C's. How does that make any sense?
Well, Dr. Bond, I see that you haven't allowed yourself to get rusty.
Whatever.
Surprised?
Well, you could have suffered from frostbite.
Listen to my excellent
Ah,
jokes.
yes. I must explain our new post-op procedures. Things have changed since you left. The chart needs to be submitted to the clerks on the second floor. And surgeons are required to attend a case review session every Tuesday morning.
That doesn't sound like
However,
fun.
We won't be needing you there just yet. I'll call for you when it's deemed necessary. Well,
I don't
then,
like this guy's voice.
Excuse me.
Well then. Excuse me. Yeah, Squidward. I don't like that guy. He's not a very fun guy. The Pacemaker. Oh, I have a bad feeling about this one. Not for us, of course, for the person that we'll be operating on today. The Pacemaker.
Will be planning a pacemaker?
Yes. You'll be performing an exchange operation to upgrade the one currently inside the patient. You'll also be performing the pre-op examination on her.
Why us and not a cardiologist?
Because I believe you
Because
two are
you
better
two are
suited to
better
perform
for
the
whatever
procedure.
reason, even though you haven't studied the heart as much as these other people.
A team of specialists will be available to assist you, but I doubt that
You know,
will
I
be
just thought about that,
necessary.
because doctors usually work on one area of the body and not the other. Generally. But these guys seem to do just about everything.
It seems they're expecting a lot from us, but you wouldn't know it by the way the staff's treated us.
This can be considered as a preparation phase for the actual operation. An appropriate pacemaker has already been selected. You'll be implanting the same type I'm currently using.
The same pacemaker you're using?
What, is that supposed to be especially sinister?
Are you sure it's not gonna hurt?
You'll be fast asleep the entire time. It'll be over before you know it.
Or you'll die, in which case you also won't know it.
But what if I wake up? Will it hurt?
We'll use the defibrillator, make you go back to sleep.
I promise that won't happen. The medicine will keep you asleep, no matter what.
There's actually been reported cases where people mid-surgery wake up. That's gotta be horrifying.
If it's gonna keep me asleep, then how will I wake up? Will I sleep forever?
We'll slap you
Well,
around a bit.
You'll wake up because you'll get hungry.
That's true,
Well,
I would
you
wake
heard
up
that your
because I
heart
get
isn't
hungry.
doing well, right? Right now you're okay because doctors put a machine in you that helps your heart. But we found out that machine isn't working like it should. So if we don't put in a new machine, your chest is going to hurt. You don't want your chest to hurt, do you?
No.
Alright then, the operation is going to be tomorrow. Let's both do our best.
Okie
Come
dokie.
on, Chloe. Let's go back to your room. Don't worry. There's nothing to be scared about. You'll be all better real soon.
Or dead. Dead's also a possible outcome.
Opening up a child's chest for the second time. As a doctor, I know I shouldn't be faced by it, but it's still heartbreaking.
Yeah, get it? Heartbreaking. Yeah.
This operation has nothing to do with the professor's orders. Let's just concentrate on doing our best for that kid, okay?
I like these two doctors at the very
I'm not
least. They all
lying.
seem...
It really hurts. Come on, there must be something you can do.
All these doctors, like these two doctors in particular, seem like they actually want to help people and they're not there for the money. Which I think is kind of cool.
I'm sorry, but we didn't find anything wrong when we examined you.
That medication I used before seemed to help. How about some more of that?
No, drug, you go away.
As I said before, I can't write you a prescription. Dr. Vaughn, can you please help me explain to this patient?
Me, Dr. Chen?
He won't listen to reason.
So maybe we'll have to use scalpels.
And I refuse to write him a prescription.
Or we'll just take out the surgery laser and start poking him with it.
He's just pretending to be in pain because he's addicted to painkillers.
What? Are you calling me a liar?
Well, I'm not calling you a truther.
Forget it. I'm out of here.
What does he think this is? A street corner? He was wandering around, so I offered to help him. The first thing he said was, I need drugs.
How did he get in?
I don't know, but I should report him to security. By the way, Dr. Vaughn, I heard that you're conducting a pacemaker procedure today.
Yep.
That's right. Since I'm the new guy, I have no choice but to follow orders.
I suppose that's true. Well, good luck. If all goes well, I'd like to ask you to be my assistant.
I'll do my best to live up to those expectations.
Crazy druggy guy. Okay. Okay, so yeah. Quick procedure is always better
Let's begin the
here.
conference for little Chloe.
Please do.
Your objective for this operation is to replace the patient's pacemaker.
I kind of gathered that, but okay.
First, you'll have to stop the old pacemaker. Then, remove it and insert the new one. This operation will require great precision and will put a lot of strain on the patient's body. Please proceed with the utmost care.
Of course. This is a very serious operation.
She's only a child, so even a small mistake could be fatal.
That's true.
Well, good luck, you two.
I'm sure this won't be a problem at all. I'm sure everything will go perfectly fine. Maybe.
Let's get started.
Or we're going to brutally kill this young child. I'm slightly worried, but it'll be fine. It'll be fine.
Today, we'll be replacing the patient's pacemaker.
If I remember correctly, it's the same model as the professor's.
Oh, really? Well, let's have a look.
All right. Pacemaker time. Pacemakers are always fun. They always like to have you
First,
operating on the
we
heart.
need to stop her existing pacemaker. Please be careful, Doctor.
Okay, how do I stop it?
Okay, good job.
Oh, I did
Looks
it.
like you're ready
Excellent.
to go on to the next.
Next what?
The
Oh,
patient's going into cardiac arrest.
quick, get the defibrillator.
We can't use the defibrillator because of her pacemaker.
Oh, never mind.
We'll have to massage the heart by hand.
Wait for the hands to overlap, then press the A and B buttons simultaneously.
So this is a new technique that they're having us do. This is basically, it's apparently a real-life technique, but it isn't used often. It's only used when a defibrillator can't be used. Okay. Got it. Ah. These can be a little annoying to do sometimes.
Thank goodness. The patient has recovered.
But we can't relax until we've completed the operation.
There's a chance she'll go into cardiac arrest again, so keep an eye on the electrocardiogram. If that does occur, then we need to massage her heart immediately.
Understood. Well then, are you ready to remove
Yep,
the
come
pacemaker?
on, let's go.
Use the
We're all waiting.
antibiotic gel to disinfect the cut the lead attached to the heart. Now that you've cut the lead, hurry up and remove the EKG. Now, place
Yeah, I
the
think
lead
we
on
need
the
to stop
tray
for a second.
and
False
Oh,
alarm.
okay, we're
Let's
fine, never mind.
continue.
What do I do here? I slightly missed what she said to do after
Okay.
that.
Looks like you got all the blood. Now, please place the lead on the tray.
Put the
And
lead
don't
on the
forget
tray.
to suture the slit where it was
Suture.
inserted. Her heart's
Oh, okay,
fibrillating.
okay.
Stop the
Okay,
procedure.
let's start
She's
massaging.
going into cardiac. That's right. Just like that.
You want to do this as quick as possible so we don't spend too much time massaging your heart. Don't die!
We have a pulse.
Okay.
Let's continue the procedure.
Okay, she's totally fine. Let's give her a little more vitals and then we'll keep going. Oh no.
Now would you please place the old device
Yep, I'm
on
doing
the
it.
pacemaker ready.
She is about to
You can
be
place it in the
defibrillating
same
again, I
spot as
believe.
the old one.
I think. Yep. We need to go fast so we don't have to do this too much. Because we are losing a lot of time when we have to do this. In addition, she also has a decent chance of dying here because her vitals are going down. Okay. Let's go.
Next, attach the leads to the device. The first lead is ready. Now that you've found the right spot, use the scalpel to cut a small slit.
Yep, we're just gonna wait a second. Man, this girl is not doing well. Okay, I know what I need to do now, so we're just gonna try to do it really quick as soon as I get the option. Do I have to locate it first?
Let's drain the blood before proceeding. It may hemorrhage again, so please insert the... Let's suture the slit before it hemorrhages. That's it for this one. Just follow the same...
Okay. Oh,
I was
okay, we're good,
worried
we're
there
good.
for a
Let's
second.
go quickly.
Let's continue the procedure.
You have to connect the lead to the device
I'm
first.
trying. Oh, come on. What, did I put it on the wrong spot? No. No, guy. Go away, guy. Go away, loser. I don't like you.
The doctor's failure haunted them both,
Of course, once you fail one procedure in this game,
bringing them much grief.
the doctors are just like, I can't do it anymore, man. I can't do it anymore.
Dr. Vaughn
And then they
Dr. Blaylock,
quit their job.
two doctors of exceptional talent, both left the field of medicine, never to fulfill their destinies.
That's what happens anytime you fail. I'll get us back up to the point we were at, and then we'll come back again. Okay, so I think we're about at the point now where we left off. I've attached both of them back. I'm actually doing a lot better on time now, I think. Just because I was able to, like, speed run it practically. So we are going to
Now
do
that
this.
That's where the second one. Let's drain the blood.
We're gonna try to do this really quick.
Okay. Bring the lead all the way. Let's suture the slit before it hemorrhages again.
Ah, dang it. Okay, we gotta wait until the thing happens and I can pick her back up. The operation basically gets put on hold, and if you try to do anything while we're waiting for the heart massaging thing to
That's
come
it
up,
for this one.
then
Remember
she
to
just
suture
starts
the
losing a
slit,
lot of
Doctor.
vitals.
Huh?
What happened?
We were almost done, too. All right, let's massage the heart.
We're going. I'm sure you could do this really quick if you were very good. I'm just not.
Okay, we're almost done. We just need to suture
Ah,
the
dang
slit.
it.
Now,
Just get sutured,
cross your
noob.
fingers. Let's activate the pacemaker.
Good. It's working properly. Should
Yay.
be alright now.
Okay, good. That was a fun procedure. And by fun, I
That's
mean
great
not fun.
news. So all we need to do is close her up and we'll be finished.
Look at those stitches. That was the best stitches you've ever seen in your entire life.
Looks like the operation was a success.
Excellent.
Well done, Doctor. I'll be sure to report the results to the professor.
Good work, everyone. We just saved a young girl's life. And we only let her die once. I expected a C rank from that. Because
Chloe,
I keep
This
failing.
is called an X-ray. It's a picture of the inside of your chest.
I keep failing every time her heart's about to start, we need to massage her heart. Because there's a period of about 3 seconds before you can do it, where if you press anything, she just takes damage.
This is the machine we put inside you during the operation. It's helping your heart beat.
Wow, cool. That's what's inside me?
You got that right.
It runs on electricity, so there are a few things you need to be careful about. Elena will explain the rules to you, so listen carefully, okay?
Did you see it? Isn't it cool?
Yeah, it's pretty darn awesome.
Yes, it certainly is. But
You
don't
go to
get
all your
carried
friends at
away
school and
just
be like,
because you
hey,
feel better,
I'm
okay?
cooler than you are. I got this cool thingy in my chest.
Now the pacemaker that's inside your chest is like a new friend. And it's going to be with you for the rest of your life.
That was a little... I don't know, that kind of almost sounded sad. It's going to be with you for the rest of your life, young human. Okay, so I did lose a lot of track of my time. So I'm not quite sure where we're at, but I'm going to do one more. Just to see if we can do it well or not. I mean, just to see if we can fit it in. I think we have enough time, but I'm not sure. We'll find out.
This is ridiculous. How long am I gonna have to wait? Excuse me, miss? May I ask you something?
Oh, are you here to visit a family member? If so, then the entrance is...
No, that's not why I'm here. I have an appointment with Dr. Rousseau, the chief surgeon. But no one's been able to get my message to him.
If that's the case, then let me call for his secretary.
I'm sorry to inconvenience you. Thank you, though. You're a doctor here, aren't you?
Yes, my name is Valerie Blaylock.
Is Professor Wilkins busy? I was hoping I might get a chance to meet him.
Yes. Well, the professor is... He's very busy. I rarely see him myself.
Well, I guess it can't be helped. But I'd still like to meet him someday. Ah, you must be Dr. Rousseau's secretary. Thank you. My name is Irene Quattro. I'm the director of Caduceus.
Caduceus? I thought it was Caduceus. Okay, that's interesting.
The organization under the direct control of Health and Human Services?
I think this lady's actually kind of important. I was making fun of her in my head, but I think she's actually kind of important.
Thank you very much for your help today. I appreciate it.
I thought it was Caduceus. Why is it Caduceus?
Hey, Marcus. It's already been 10 days, and he still hasn't told us about his condition.
I'm sure he hasn't forgotten. He must have his reasons.
He sure is taking his time, considering the trouble he went to bring us back here. Oh, by the way, this morning I met someone that was here to see Rousseau. I was surprised when she introduced herself. Take a guess who she was.
His mistress?
Very funny. Come on, be serious.
I know him better than you do.
Well, it turns out she's the director of Caduceus.
I guess it makes sense it's Caduceus. I just always thought it was... I always shortened it in my head to Caduceus. I guess it's Caduceus.
She oversees
sounds
all
kinda
the
funny.
medical research institutions located in the U.S.
She's from Caduceus?
Actually, she seemed more interested in speaking with Professor Wilkins. I wonder how she knows about him. Isn't it strange?
It sounds like trouble, if you ask me.
Make it double. Which it actually makes sense considering that we have two doctors.
We need you in the OR.
What's the matter, Elena?
3 people were hit by a car. 2 are in critical condition.
Oh, good.
Dr. Rousseau began treating the one who was in the worst state. But he left to treat a different patient and ordered you 2 to take the ones in critical condition.
We can't afford to waste any time. His life's in jeopardy.
Okay, cool. So is this gonna be... Are we gonna have to do 2 people in a row like that one special mission I had to do? So reconstruct the rib bones and
The
treat
patient is
probably
Ricardo
cuts
Garcia,
of glass
a
and stuff.
35-year-old male. He was in a car accident. He has injuries to the abdomen, including a few broken ribs and a pierced spleen.
That sounds painful. I would
This
know.
doesn't
I'm a
look
doctor.
good.
In this operation, we have several objectives. We need to treat his lacerations, repair his broken ribs, and attend to his spleen.
This will be a difficult operation.
Spleen.
No wonder Rousseau took off so fast.
Well, I'm sure we can handle it.
We've
Don't worry, we're
analyzed
gonna
his
attend
blood
to your
type
spleen,
and done
guy.
necessary screening and cross-matching. We've also got an ample supply of blood on hand. All you need to worry about is the operation.
That's good, because I've never had to worry about blood before, and I don't plan on doing it now. Come on, Marcus. It's time to do
All
some
right, let's begin
operations.
the operation.
I'm assuming we're doing more than one. Oh, where's the guy? There's no guy here. Oh, there he is. Oh, we're already in him. Okay.
Doctor, hurry! The patient's gone into cardiac arrest.
Oh. Why did the audio just go away all of a sudden? I hope I'm not having that issue I used to have with the capture card where it suddenly cuts out. If it just did, I'm sorry. But I thought that was done with. Anyway,
we
let's
need
go.
to use the defibrillator.
Yep, we're defibrillating. Can you guys hear the vibration in the remote from the mic? The vibration of the Wii remote?
We have a pulse.
I
His
think I
spleens
saw
in
it on
bad
the
shape,
thing, but
and
it
his vitals are dropping
might come
because
out
of
in the
massive
recording.
hemorrhaging.
We'll have to retrieve the bone fragments while treating the injuries and hemorrhages.
Oh, those aren't glass, those are bone
We
fragments.
won't be able to suture that
In
big
his
of a
spleen.
wound. We'll have to close it first with the force.
Now pinch once. Okay. Now hurry up and suture it.
I'm
That
familiar
takes
with
care of
closing
the
wounds.
largest wound. But don't forget about the others.
Oh man, why is he suddenly getting cuts everywhere? What's cutting him? What's cutting you, man? What are you getting cut by? Oh man, this ain't good. Getting like ghost cuts from what is cutting this man?
Doctor,
Oh,
please
wrong
be more
way.
careful.
I'd like to know why this man's suddenly getting cuts out of nowhere.
We're making progress with the bone fragments, but the spleen requires immediate treatment.
I'm trying, but this stupid man and his stupid spleen is like suddenly rupturing cuts out of nowhere.
Looks like
Now that we've taken care of the wounds, we can
Okay.
reassemble the bone fragments.
Let's begin. Let me get him some vitals before we start. It's like a lovely jigsaw puzzle. Where does this go? Maybe there?
it doesn't
Nope.
seem to fit. Could that go somewhere else?
Maybe there? Yeah, there we go. That fits there. Okay. See, I told you, Dr. 250's
So
Dr.
far, so
250's
good.
got this.
We're almost done.
I
What?
think we're missing a bone.
That was the last
Are we gonna
piece.
find a bone like in his heart or something stupid?
Don't tell me we missed a fragment.
Where is it?
This isn't good.
Uh,
We'll have to use the defibrillator.
Yeah, I think you can hear the vibration, but I don't know if I'll be able to cut that out or not. Not that it's a big deal. It doesn't happen often. There we go.
Was that hemorrhagic shock? His spleen was bleeding pretty
Yeah,
heavily.
his spleen was literally bleeding.
Got it?
What the heck?
No wonder
I just
we
want to
missed
take a
it.
drink of water. What's going on?
Okay, doctor. You know what to do. Be sure to keep an eye on his vitals, though.
Why is this man dying? Oh man, okay, we gotta do this. Oh, except I can't draw a star. That's the only problem with the star thing in the
What on earth
game.
are you doing? I can't allow this to continue.
I'm trying to draw a dang star! Don't get mad at me, woman! What the heck?
Doctors bringing both.
I'll be right back. I'll get us back to that point again. I'm sure I'll have to use that ability, but whatever. We'll be right back.
What?
Okay,
Don't
we're
tell
back
me we missed a
again.
fragment.
Let's see if I can pull
This
off a
isn't
star
good. We'll
right
have to
after we
use
do
the
this.
defibrillator.
Oh, man, I'm so bad at landing those defibrillator shocks. Don't die on me, man. Got it. Okay, there we
Was
go.
that hemorrhagic shock? His spleen was bleeding pretty heavily.
Let's see if we can do this before he dies.
No
We're gonna
wonder
draw
we
the star
missed it.
just right off the bat.
Okay, doctor. You know what to do. Be sure to keep an eye on his vitals, though.
If I can draw a dang star to save my life. There we go. Oh no, 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 don't die, man. Don't die, man. Why is he suddenly just like generating cuts from nowhere? What is cutting him? What is cutting this man? I want to know why this man is getting cut. Is that a bone?
We've got all the pieces now, but please treat his
I'll
remaining
treat his
wounds
dang
first.
wounds, man. This dang guy, he's got like pieces of bone lodged in his spleen and they're coming out and making giant cuts everywhere.
All right.
I think you need some gel on these. Oh, maybe not yet. Okay, we have to place the last one, then we do the gel. That is a big piece of bone you got in you, guy.
All the pieces are in place. Let's cement them together with antibiotic now. That completes
This
the
dang guy and his stupid spleen. His stupid spleen is just like
Please close him
rupturing
up.
everywhere. Okay. Whatever, we did it. Do we have one more patient that we have to deal with, or is that going to be the only one? He did say something about 2.
It was an unexpected operation, but I'm glad it went smoothly. Well done, team.
Okay, good, that's it. I was worried that we're going to have to do 2 people, and the second guy was going to be just as painful, but apparently not. We're good. Man, I would be surprised if I got anything but a C on that one. That was absolutely
I
horrible.
see that you were both quite skilled.
Oh yeah, I'm great at drawing stars. It only takes me
I'm
3
sorry,
tries.
you are?
I'm Irene Quattro from Caduceus. Nice to meet you.
Caduceus.
I heard there was an emergency, so I changed into my surgical gown. But I see that wasn't necessary.
Valerie, is this the woman you were telling me about?
Thank you, ma'am. It's an honor to receive such praise.
A doctor with a healing touch. It's been a while since I've been surprised like this. If the opportunity arises, I'd like to see it used again.
Oh, I'm sure you'll see it used plenty of times.
I'd be glad to show you.
This is an impressive hospital.
I'm pretty
I
sure
hope that we
Valerie
meet
would have been
again.
more useful in
Please
that mission
excuse me.
just to keep the guy's dang vitals up so I could... Because I was having trouble even with the healing touch just getting the situation under control. I'm sure with Valerie I could have stabilized the vitals and actually done something useful.
I don't think it was good for her to have seen that.
What do you mean, Marcus?
There wasn't much of a choice.
Thank
The
you.
healing touch was going to happen
Thank
regardless
you
of what
so much,
happened.
Doctor. We were told he wouldn't make it, but you saved him.
I did it for the baby, ma'am.
I just did my best,
Oh,
Mrs. Garcia.
never mind. This guy. I don't like this guy.
Considering his injuries, it's a miracle he survived. He must have an angel looking over his shoulder.
I don't know how we'll ever repay you.
Oh,
Thank
I'm
you
sure
so
you could
much.
pay a sizable amount of money to this
There's
man and
no
he
need
would
for
accept it.
tears. Now, let's discuss his future treatment options.
Oh, as long as he's in your hands, Dr. Russo,
Dr.
I know
Rousseau!
he'll be okay.
Dr. Rousseau!
Oh, it's you, Vaughn.
Look,
Marcus,
his expression changed.
It's not
Ron.
worth getting upset over. The patient is all right. That's all that matters. Professor Wilkins has asked to see us, so we'd better get going.
I suppose you're right.
So, I think I caught this, but did this doctor basically drop this patient and tell us that he had to work on it and then went to go help this baby or whatever?
Dr. Russo, is something
I think
wrong?
that's what happened. Yeah, that's what it was.
No, it's nothing.
It's nothing. Sweating.
Please come with me, Mrs. Garcia. Let's go see how your husband is faring.
I'm sure he can pay us a sizable amount of money, see?
So, I heard that Rousseau took credit for everything. You must be disappointed.
I'm just glad the patient's okay.
He's an excellent doctor, although rather shrewd at times. And I would never trust him to operate on me. That's why I summoned you here, Marcus. You have a rare talent.
I didn't want to come back.
I'm aware of that. Regardless, we'll meet tomorrow to discuss my operation. The procedure is scheduled for 4 days from now. I'll leave you to choose your team.
Okay.
Okay, so there we go. Sorry, I kind of got lost in thought again for a second. I didn't say anything. But this is where we're going to stop off for today. This might have been a really long episode, or it might have not. Depends on how long my little phone break I had to take took. But we will continue from here next time and learn about this stigma, because you remember this guy said that he has stigma. And as of now in the story, you as the player don't know what stigma is, so... And maybe if you haven't seen the game before, then you might not know as well. But anyway, when we come back next time, I'm pretty sure this is when we'll actually learn what this strange stigma is. The stigma that's a stigma. Yeah, anyway. Thanks for watching. Hope you guys enjoyed. And I'll see you next time for more Trauma Center New Blood. Bye!